Good day everyone and welcome to another video under the Anatomy Unlocked channel. I promised to release a video on study hacks, study tips to help medical science related students and other health science related students with anatomy students and even physiology students on how to study anatomy. And here I'll be giving you 10 powerful anatomy study hacks using examples also from thorax, abdomen, pelvis, perineum, and neuroanatomy to buffer up these 10 anatomy study hacks that you can apply to the way you read, the way you recall, and the way you remember anatomy courses. So anatomy becomes very easy when students don't just rely on passive reading alone, because the truth is you can't just keep reading and expect to understand anatomy that way. There are some other things you have to add to just reading. Some active and strategic learning method that you have to add to just your reading alone. If you're just reading passively, you'll find it difficult to recall and remember anatomy as a course. But with these 10 powerful anatomy study hacks that I'm going to be giving you, I can guarantee if you apply it to your reading skill, your reading schedule, the way you read anatomy, you're going to see a difference. So let's move into these powerful hacks that you can apply. And the first one is study anatomy by functional relationship. An easier way to remember anatomy, to memorize anatomy, is to study structures together. Study how they work together. Don't just study them individually. Don't just isolate one organ from another organ. Study them together. Put them together. Learn how they work together. And it's going to be easier for you to remember. And an example under thorax is the heart, the lungs, the ribs, intercostal muscles, and diaphragm. They work together for respiration and circulation. It will make it easier for you to remember. When you hear the heart, the lungs, the ribs, all these structures all together, they work together for respiration and circulation. It's much more easier to read them together and learn how they work together than just isolating each of these structures and learn about them. Understanding how intercostal muscles assist breathing help you to remember their location and function. In neuroanatomy also, the cerebellum, the vestibular system, and spinal cord pathway work together for balance and coordination. So when all these structures are connected together by function, they become easier to recall. You can easily remember them than trying to recall them individually. The next one is use clinical correlations. Don't just read anatomy alone like that. You have to correlate it to the clinical scenarios, clinical anatomy, applied anatomy, clinical pathology. Clinical correlation connections make anatomy more meaningful and memorable. So it makes it more meaningful and you're able to remember it. For example, under the thorax now, the phrenic nerve that supplies the diaphragm. When there's compression of this phrenic nerve, it affects the diaphragm and it causes breathing difficulties because the diaphragm is the chief muscle of respiration. So when this phrenic nerve is compressed, it's going to affect the diaphragm and it's going to lead to breathing difficulties. Also in the abdomen, when there's inflammation of the appendix, it will lead to pain in the right lower quadrant because that's where the appendix is situated. So when there's inflammation of this appendix in condition called appendicitis, it will lead to pain in the right lower quadrant. And neuroanatomy, damage to facial nerve. The facial nerve is a nerve that supplies sensory and motor innervation to the muscles of the face and the skin of the face. So when this facial nerve is damaged, it's going to lead to facial paralysis, Bell's palsy, facial paralysis. So connecting clinical pathologies, clinical scenarios, clinical correlates with anatomy makes it easier. So students remember anatomy better when they associate it with clinical condition. That's the second one you can add. The third one is learn structures layer by layer. If you look at the human body, most of these structures they have layers. So learning structures layers by layer it will be one way for you to understand anatomy better. Anatomy is organized into layers and studying it this way improves visualization. You're able to recall, you're able to Imagine the way it's supposed to be, like the layers starting from the skin, looking at this abdomen as an example. For example, the anterior abdominal wall layers starting with the skin, superficial fascia, the external oblique muscle, internal oblique muscle, transversus abdominis muscle, transversalis fascia, then you get to the peritoneum. So if you are able to learn anatomy using layer to be easier, you follow the layers, you're able to visualize it. After this layer comes this layer, after this layer comes this layer. For example, another one is in the scalp. The scalp, SCALP, the scalp. You start with the skin, the connective tissue, the epicranial aponeurosis, the loose connective or loose areolar tissue, then the pericranium. This way, you are able to easily remember. Another example is the in neuroanatomy is the brain covering, starting with the dura mater, followed by the arachnoid, followed by the pia mater. So, learning anatomy in a layer-based way, it helps to strengthen what we call spatial understanding. Spatial, you're able to picture it, you're able to visualize it, not just see it, but also visualize it, imagine it. It will make it easier for you to learn anatomy. Then the next one is use mnemonics for listening. Use mnemonics for listening. Using mnemonics a lot will really help you in anatomy, because anatomy has many lists, and these lists, an easier way for you to remember them is to use mnemonics. Yes, an easier way for you to remember them is to use what? To use mnemonic. That is the best way to remember some of this anatomy list, because anatomy will have a lot of listing. And for example, in the thorax, the branches of the aortic arch, mnemonic for it is ABC. ABC. A for aortic arch, B for brachiocephalic trunk, C for carotid, or the left common carotid. So ABC is one way to remember the branches of the aortic arch. Then also, neuroanatomy for the 12 cranial nerves. 12 cranial nerves, one way to remember is to use the mnemonic that is called OOO, to touch and feel very good velvet hair. OOO, to touch and feel very good velvet hair. O, you know how it goes: optic, ophthalmic, oculomotor, trochlear, trigeminal, abducens, facial nerve, vestibulocochlear, glossopharyngeal, vagus, accessory, spinal nerve, and hypoglossal nerve. It will make it easier for you to remember. Yes, mnemonic reduce memory load during exam. Yeah, this using mnemonics will be able to reduce the load, because trying to cram, trying to remember almost all the list anatomy will really be difficult to do that. But with mnemonics, it will be much more easier for you to do that. Then the next one is convert text into diagrams. Yes, convert text into diagrams. I always tell my students, I always tell you guys, tell my students, if my students are watching this, I always tell them that it's not enough for you to just know it in words. Convert some of these words into diagrams. Diagrams are one very good and best method, best way to learn anatomy. Reading paragraphs alone is insufficient, is inefficient, is inadequate for anatomy. You have to learn diagrams. Now, instead of just reading only paragraphs, reading notes, you can convert notes into flowcharts. You can draw simple diagrams. You can use labeled sketches. All these will help and assist you to remember and recall anatomy easier. An example is the pelvis. You can draw the female and the male pelvis to be able to visualize the relationship between them, even the similarities and the differences, because we have differences between the male and the female pelvic organs. So using diagrams can help you to do this better. Also, neuroanatomy. You can sketch the brainstem showing the midbrain, the bone, pons, and the medulla. This will stick more. Drawing, there's a way drawing strengthens visual memory. And this visual memory is very crucial in anatomy. You want to make sure you're able to recall. So convert text into diagrams. Then practice recall with blank diagrams. Practice recall. You pick unlabeled diagrams and try to label it yourself. Diagrams are not labeled. Try to label it yourself. This is one way you can also do that. You can do that using the heart chambers, the major vessels, the lungs. For our thorax and abdomen, you can draw diagram of the liver. Look for it and label it yourself. Look for a diagram of the stomach, the pancreas, the spleen. Name it, the brain, cerebellum, and try to label it. This will help you to actively recall what you have read, and this will in turn convert your short-term memory into long-term retention. You can remember them for a longer period of time. The next one is to study anatomy in regions. Study anatomy in regions. Anatomy majorly is studied in regions. You take it region by region: the head and neck, the thorax, the abdomen, the pelvis and the perineum, the upper limb, the lower limb. So one easier way for you to study anatomy, to make it easier for you to remember, for you to make it easier for you to recall, and to give a long lasting memory of anatomy, is to study it in regions. Study anatomy in regions. You can take it region by region. For example, at thorax, you take the heart, the lungs, the mediastinum. Under the abdomen, you take the major arteries, the portal system, the digestive organs. Pelvis and perineum, you take the reproductive organs, with the external, the internal, the pelvic floor muscles. This is one way to study anatomy better. Use regional classification, and you stick more than you just reading it in isolation. The next one, the eighth one, is to link structure to function. Link structure to function. Anatomy and physiology go hand in hand. Yes, anatomy deals with the study of structure. Physiology deals with the function of this structure. But when you link both together, there's a way it make it easier for you to recall anatomy. Link structure to function. Now, for example, the question is, what does this structure do? The heart. What does the heart do? What's the function of the heart in the body? What does it do? It pumps blood. The diaphragm. What's the function of the diaphragm? It's the major module of respiration. The occipital lobe of the cerebrum. What is the function? It's for vision. So helping, using functions and relating it to the structure, help the brain to store the information better and logically, and even help you when you are trying to write and come up with notes in anatomy, because there's no way to talk about some of these structures that you not at least want to talk about their function, what they do in the body. Then the ninth one is to use story-based learning. Use story-based learning. That is, creating small stories help memory. So you can try to remember some of these structures using stories that is easier for you to remember. For example, you can imagine it, the abdomen. You can imagine food traveling through the digestive system, coming from the mouth to the esophagus, down to the stomach, the small intestine, the large intestine, and down to the anus, the rectum, the last part before it goes, the waste part goes out. So this story makes it easier for you to remember organ sequence and also their function. You see the way it's going to make it simple. Use story, something that will make it easier for you to remember, and relate it to anatomy. This will make you faster in your learning and also make it easier for you to recall anatomy. You get it? Then also neuroanatomy. You can try to think of the brainstem also as a communication highway that carries signals between the brain and the spinal cord. So if you remember all these stories, it will help you to remember these things, help you to improve recall, because the brain remembers narratives better than just isolated facts. The next one is teach someone else. Teach someone else. I always emphasize this. The best way to learn something is to teach somebody. Teach your colleague, teach your fellow coursemate, teach your junior ones, those also in the lower level than you. Teach those that are even in higher level than you. Teach. The more you teach, the more it sticks more. Try to explain topics, even topics that you yourself don't fully understand. When you explain to someone, you notice that you understand it better. So that's one way you can also learn anatomy. Teach them. Teach the topic. For thorax now, you can teach how the heart pumps blood, abdomen, how digestion occurs, the role of pelvic floor in childbirth, pelvis and perineum. In neuroanatomy also, you can try to teach how neurons transmit electrons, how they transmit signals. So when you explain the concept clearly, you self, you truly understand it. The more you teach, the more you understand it. The more you teach, the more you understand. I hope with these 10 tips I've given you, it will make it easier for you to study anatomy. If you like this video, click it, share, subscribe to the channel so that I can produce and release more videos like this. And if you have questions, you have topics that you want me to explain in videos, drop it in the comment section, and I'll check through it and pick some of these topics to create a video on next. Thank you for listening, and I'll see you in the next. Thank you for watching, and I'll see you in the next one. Bye.